This video only covers selected highlights of the RemunityPRO Pump User Guide and is not intended to replace the user guide. For complete details, including warnings and cautions related to the RemunityPRO Pump, refer to the user guide. For safety information related to Remodulin, please see the end of the video and the full prescribing information. In this video, we will cover steps to follow when setting up the RemunityPRO Pump for the first time. For this video, you will need the remote, the RemunityPRO Pump, a pump battery, and the dosing sheet. Make sure the pump battery is fully charged and the remote is charged. A passcode is required to make changes to the delivery rate. To begin, power on the remote. Tap the check mark to begin setting up your passcode. Choose a passcode that you will remember. Set the same passcode on both remotes. Using the keypad on the remote, enter your new 6-digit passcode and tap the check mark to continue. Enter your new passcode again and tap the check mark to confirm. Pairing the remote and pump enables the remote to control the pump settings, prime the pump, and set the delivery rate. The RemunityPRO Pump is shipped with a pump cover attached. To remove the pump cover, hold it in one hand and rotate the pump counterclockwise with the other hand, then lift. Store the pump cover with your other supplies. Next, remove a fully charged battery from the battery charger and insert it into the pump. When the battery is inserted successfully, the pump will sound a quick beep, followed by a ready beep, and the remote will advance automatically when it is ready. Do not press any buttons until the second beep is heard, as it may disrupt the Bluetooth pairing. Place the pump and remote within 2 inches of each other during the pairing process. The pump serial number will automatically be displayed on the remote. The pump serial number is located on the bottom of the pump. The pump will only pair with the remote that has the matching serial number. If the pump serial number does not appear, select the blue info icon on the remote for more instructions. Once the pump serial number appears on the remote screen, tap the check mark to continue. Tap Yes to pair to the selected pump. The remote will ask for the pump pin, which is located on the bottom of the pump, to confirm pairing. Enter the pin and tap the check mark. The remote will display the paired pump screen once it has successfully paired with the pump. Once the remote and pump are paired, the remote will ask for a delivery rate, which is the amount of medication the pump will deliver hourly. The delivery rate is found on the dosing sheet provided by the specialty pharmacy using instructions from your healthcare provider. The delivery rate should always be set with direction from your healthcare provider. To set your prescribed rate, swipe up or down on the remote and tap the check mark to confirm. Now you're ready to fill and prime a cassette. RemunityPRO Pump for Remodulin Treprostinil Injection. Indication: the RemunityPRO Pump for Remodulin Treprostinil Injection is intended for continuous subcutaneous delivery of Remodulin Treprostinil Injection for use in patients ages 17 and older. Important safety information for RemunityPRO. Warnings and cautions. Do not use the system outside the conditions listed in the user guide. Retain the user guide for future reference. Refer to the user guide for all warnings and cautions. Failure to comply with the following warnings and cautions may result in harm. Limited to use with Remodulin. Only RemunityPRO cassettes may be used with the RemunityPRO Pump. RemunityPRO Pump is for use only with FDA-cleared infusion sets. Medtronic Quickset Infusion Set, MMT-392, MMT-393, NariaGuard, 704060-5229, 704060-5226, Medtronic Silhouette Infusion Set, MMT-373, and Smith's Medical Clio 90 Infusion Set, 21-7-230-24, 21-7-220-24. Do not use disposables from previously opened or damaged sterile packaging, damaged disposable components, or expired sterile components. If the pump or remote fail to work as detailed in the user guide, stop using the pump and remote and switch to the alternate pump and remote included with your system. Only use the supplied cables with your RemunityPRO system, as other cables could interfere with pump function. Disconnect the infusion set tubing from your infusion site before removing the cassette from the pump. Avoid exposure of your pump and cassette to temperatures below 41 degrees Fahrenheit, 5 degrees Celsius, or above 104 degrees Fahrenheit, 40 degrees Celsius. The pump may affect nearby electrical and electronic devices, including medical devices, cell phones, Bluetooth devices, RFID readers, Wi-Fi equipment, and strong magnetic fields, causing these devices to operate abnormally or to stop functioning. Keep the pump, remote, and battery charger at least 12 inches, 30 centimeters, away from electrical, medical, and wireless devices. Do not open, crush, heat above 140 degrees Fahrenheit, 60 degrees Celsius, or incinerate the pump battery or remote, as doing so can lead to fire, burns, and property damage. This system supports flow rates between 8 microliters per hour and 225 microliters per hour. If the required flow rate is outside this range, discuss with your specialty pharmacy or healthcare provider. Prescription information. Caution. Federal law USA restricts this device to sale by or on the order of a licensed healthcare provider. Use of this device without the training and supervision of a healthcare provider may lead to errors that result in harm. See the RemunityPRO pump for Remodulin treprostinil injection user guide for further detailed important safety information including warnings, cautions, and instructions on how to properly use the system. For further information, please call United Therapeutics Corp at 1-844-864-8437. The RemunityPRO pump for Remodulin treprostinil injection is manufactured for United Therapeutics Corporation. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. Remodulin treprostinil injection. What is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver problems. Your Remodulin dose may need to be adjusted if you have liver problems, have low blood pressure or bleeding problems, are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure, symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilatation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-844-UNITHER, 1-844-864-8437.